Hi fans, hi viewers, you're welcome to today's edition. And of course, this is Miss Ika Show and I am your favorite host, Miss Ika. Thank you so much firstly to those of you who have subscribed to the channel. Thank you so much to our new followers. A big shout out to you all. Remember that I'm here because you are there. Without you, there can be no me. If you haven't yet subscribed, you haven't yet liked, please do so. And when you subscribe, don't forget to turn on the notification bell so that you can be notified immediately we drop our new videos. Okay. Today I want us to look at something that is of great concern, not just to me, but to all of us. Have you ever found yourself in an accident scenario and you realize that people are taking videos, people are just standing and looking at places, knowing very little or nothing to do at all? If you have found yourself in a situation like that, then you want to stay tuned to learn something new today. This video is definitely for you. Yes, today we are going to be looking at trauma. Now, what is trauma? Before we go into details, I want us to understand some basic concepts about trauma. What exactly is trauma? Trauma is any injury to bodily tissues that is as a result of a sudden high energy that the body cannot withstand. You understand? So firstly, you have to understand that it is injury to our body tissues, and you have to understand that it is of high energy that your body cannot withstand. That Why do we say high energy? To some people, they may have a traumatic event, but the body can withstand, so they will not have any injuries at all, while other people are going to have injuries. Now, today we want to focus on a scenario like an accident scene you get. So it really baffles me sometimes when an accident occurs and you go there, you find the majority of people, what they are doing is some of them are videoing, others are just onlookers standing there looking and maybe calling one or two people. Yes, all of that is important, but then we can do something more to see that in as much as we're trying to make these videos, we're trying to snap what is happening so that others can be informed. Of course, we need news in our day-to-day lives. In as much as we are trying to do all of those, if we could just take out 2 minutes of that time to do something to save somebody, that is going to be very, very important. Like I always say in first aid, time is a very, very important parameter. 2 minutes is capable of saving someone's life, as well as 2 minutes is all somebody could need to transition from this world onto the other world. So now we are going to see how we can easily assess these traumatic patients and what you and I can do, both as a medical person and someone who is a non-medical person. Because I know, yes, you'll be telling me, oh, I'm not a medical person. How do you expect me to help? What do you expect me to do? I know nothing about medicine. Yes, dear, you know nothing about medicine, but there is still something you can do. Apart from videoing, there is something you can do to save someone's life. So in this video, I'm just going to show you the basic things you can do. Now, in trauma, we have different protocols for assessment and for management. The most widely used protocol that we all know is the Advanced Life Trauma Support, which is the ATLS. And in the Advanced Life Trauma Support, we have the primary survey, and then we have the secondary survey and the definitive management of that patient. So as I'm going on in the video, I'll be explaining to you the different things that you need to do in the primary survey, in the secondary survey, and also in the definitive management based on if or not you are a medical personnel. Then the second approach I want us to look at in this video is the 5 R's, the approach of the 5 R's. I'm going to state the different R's, what they mean, and what we could be doing in these different times. So I'm going to use the 5 R's and I will incorporate the ATLS into these 5 R's that we have. Now, the first R we are going to see is rapid assessment. So if you find yourself, for example, in an accident scene, you have to rapidly assess this person. I've told you that time is an important parameter. So in less than 10 seconds or 10 minutes, you should be able to assess that, oh, this is what is happening, and this is what I'm supposed to do. So in rapid assessment, I'm going to give us some bands. We are going to follow those bands to know. So if you find yourself in an accident scenario and you find out that somebody is already dead, you're already able to tell that this person has no signs of life. There's no breathing. There's nothing. There's nothing. That is the red band. That is the black band. We call it the black or the white band. Some people say the white band, some people say the black band. So either way is fine. Now, if somebody is already dead, there is no reason why we should spend time on that person. Because the person is already dead, there's nothing you can do, neither as a medical person or as an or a non-medical person. So we leave that those type of people. Or you see that this person is already in a bad shape, they're already gasping, there's nothing else, they are so damaged. You leave those kind of people, they are in the black or white band. Now we move down to the red band. The red band people are these critically ill people who need attention. That's, they can only withstand for like 5 to 10 minutes. They need attention within 5 to 10 minutes. Now, those are the people in the red band section. You need to attend to them as fast as possible. So you do a quick assessment on them, and those are the people you should focus your attention on. Now, the third band of people are the people in the yellow band. Now, these people in the yellow band, they are injured, they are critically injured people. However, they can withstand within 1 to 2 hours, which means that no matter what we do, in 1 to 2 hours, we should be able to get them to the hospital where they can get treatment. So those people, we first of all focus on those in the red band. That's the people who need care between 5 to 10 minutes before we move down to the people who need care between 1 to 2 hours, you get. And then now we have the last class of people, the green bands. Now, people in the green bands, they have been injured, yes, but then they are not dying. These are people who can still stay for up to 1 or 2 days before receiving medical care. So, of course, that will be the last set of people we are attending to. So, if there is an accident scene, just based on this simple assessment, you know exactly where to divert your attention to and who to focus most of your attention to, you get. Now, we are done with rapid evaluation. Let us look at resuscitation. Now, in resuscitation, this is where the advanced life trauma support comes in, where we are looking at the different parameters, what to do. We have already assessed this patient. Yes, this patient is in this band, is in the red band, is in the yellow band, is in the green band, whatever. Yes, we have assessed all of those people. Now, what do we do? That is when the second R comes in, that is resuscitation. And under resuscitation, we are going to be looking at the ABCDE approach, where A is for airway and cervical spine, B is for breathing, C for circulation, D for disability, and E for exposure. Now, in some of my videos, I dropped a video on how we can assess a critically ill patient or a traumatic patient. So I'm going to drop the link in the description box so that you can see how you can manage an injured patient. So talking about advanced life trauma support, you're going to look at that in the video I dropped before. Now, I'm going to move straight to the radiology and other investigations. Now, when it comes to radiology and other investigations, I want you to know that this is strictly for health personnel because, of course, as a non-medical personnel, you will not be requesting for a radiologic test. So this is where the health personnel comes into play. And this is when we have already done our ATLS. We have checked that there is the airways are patent, the mouth is not obstructed, breathing is efficient, the person is not gasping. So all of those, you see it in the other video that I've dropped the link in the description box. And then for radiology, the health personnel will do that once they manage to get themselves to the health facility. And there are some critical exams that we must request as health personnel when we have a traumatic patient in front of us. You want to look at the chest x-ray to be sure that the lungs are clear, every organ in the chest is free. You want to request for a plain or an erect abdominal x-ray to see that everything within the abdomen is fine. We don't have any perforations anywhere or any hemorrhage, any internal hemorrhage. And then you also want to look at an x-ray of the pelvis. You want to check all of those to be sure that everything is fine, without forgetting that you also need to do an x-ray of the C-spine. Okay, that being said about radiology and other investigations like full blood count and every other thing, bleeding time, clotting time, blood group, you need to do all of those things under your other investigations. Then we come to re-evaluation. That is the fourth R, re-evaluation. Now, under re-evaluation, we are looking at the secondary survey. Remember, I told you that under the advanced life trauma support, we have the primary survey and the secondary survey, and I was merging these two approaches to see how we can better manage these patients, right? So now, under the re-evaluation, we'll be looking at secondary survey. Under secondary survey, we are done with stabilizing this patient. We are done with doing all the basic things that we need to do to keep them alive. So now we want to do a secondary survey, and under secondary survey, we are going to move straight to a complete history of this patient. So the simple mnemonic I like to use when we're doing a secondary survey is sample. S for the symptoms you get for the patient. A for any allergic history or any history of allergies. Then you want to get M for medication history. You want to have P for the any relevant past history, and then L for the patient's last meal, because you need to know this traumatic patient you have in front of you, when did they have their last meal. And then E, you want to get E for the events related to this particular injury. So when you have all of those, you have all of these, then you can come up with a concrete diagnosis for this patient and a better way to manage this patient when you have all of this information. And then lastly, ladies and gentlemen, for the last arrow, it's going to be rehabilitation and repair, or repair and rehabilitation. Yes, we place this person. Now, this is strictly two for the medical personnel. Remember that for the first 2 hours, anybody, whether you're a medical personnel or not, you should be able to do a rapid evaluation. You should be able to do resuscitation. That is for non-medical persons. Then for the last 3 hours, which is radiology and other investigations, re-evaluation, rehabilitation, that has to do now with the medical personnel. So after treating this patient, we want to try our best as much as possible to see that these people recover and they are able to go back to their activities before this before the occurrence of this traumatic events. So I hope you've learned something. If you have any questions, please, we'd love to hear from you in the comment section. Thank you so much, and I'm going to bring you more videos on how we can manage trauma, how we can manage fractures in a non-operative way. So please stay tuned. If you have not subscribed, please do so. Thank you so much for your support and for your love. I love you right back. Bye bye. I remain your favorite host, Nurse Ika. Bye bye.